So in this week's video, we're looking at the COVID-19 lateral flow test. I'm going to be teaching you how it works. We're going to be going through it step by step. We're going to be looking at the results and what to do with them and loads more. So at the end of this week's video, you are going to be a COVID-19 lateral flow test pro. Believe me. Now this is going to be quite a long video and I appreciate you might not have the time to watch all of it. So if at any point you want to find a specific piece of information, I am going to break it down all in the description below. There'll be timestamps available for you to click on to find the relevant information that you desire. However, if you want to watch it all, then let's begin. Let's start with some background. So let's begin with a bit of science. What is the lateral flow test? Well, these things have been around for quite a long time. We use them to check for the presence of a certain substance, usually a certain protein, for example, and we've used them for a long time, like I said. For example, you might have seen them in pregnancy tests, very commonly used in that. However, now we're using them in COVID-19 tests. With coronavirus, we know that 1 in 3 people don't show symptoms, which is why the lateral flow test can be quite useful in showing those asymptomatic patients, so patients who don't have symptoms, that are positive with COVID-19. So you will know that you've got COVID-19 and you need to isolate instead of going out and spreading it without even knowing it. Now, one of the major benefits of the lateral flow test is that it's super easy to do. Anyone can do it. You don't have to be a healthcare professional, and also you don't need to send it off to a lab. It's quick. It usually gives you a result within 30 minutes depending on which lateral flow test you have. We're going to look at that shortly, and it's just really simple to do. So that's a bit of the background done. Now let's look at what's in the box, what to expect, and then we'll go into the actual testing procedure. Okay, so let's first start with the kit. Look, the most important thing when you open any kit is whip out that instruction leaflet. This is the most important part of any lateral flow test kit that you use. Whether it's the IVD one that I'm using, or if you're using a different one, please first open this information leaflet and read the relevant part on how to use it, because all of them do vary slightly. So get yourself read up and clued up on the information leaflet, and also watch this video, but don't entirely rely on everything I say on this, because your kit might be slightly different and you're going to be able to incorporate all the information from the leaflet and mix it into what I'm saying, which is going to help you understand how to use it properly. So within your kit, you should expect the following. So first of all, you're going to have the COVID-19 test cartridge. The thing that I showed you earlier, it comes in a thing like this. You cut it open and it's within there. You also got a disposable testing swab, okay? We've all seen these before, I think, I hope you have. So it's got a little plastic handle there, and it's got the little fabric bit at the end that you use for testing. Next up, we've got the extraction tube, and we've also got the extraction solution. This is the bit that varies between different testing kits. For example, the IVD one comes like this. So you've got all your extraction solution in there, and you put a certain amount of drops in there, and that's ready for testing. Other test kits come differently. So some of them, it comes as a sachet. So your solution, your extraction solution, comes as a sachet. It's got a pre-measured amount in there that you pour within your extraction tube. And I've also seen test kits that come as just an extraction tube, and it's got the actual extraction solution in there, and it's sealed on the top, and you open it. So just be aware of that. There will be slight variations in the test kit that you're using, but overall they're doing the same thing. Some test kits also come with a tissue paper, they come with an extraction tube holder, but the IVD one doesn't, so just be aware of that. It's good to have some tissue paper at hand, and it's good if you don't have a holder, maybe get a plastic cup or a cup or whatever, and just place this in there upright when you put your extraction solution in there. I will talk about this a little later. And lastly, it would be useful for you to have a timer ready. If you don't have a timer, just use your phone, make sure it's clean, and use that as a timer, because all of this stuff is timed, but we're going to go through that. I know this sounds like a lot, but it's very simple once you get your head around it, and now I'm going to go through it step by step and simplify it for you, so let's go. Okay, so step number 1, before we start doing anything, before we open our test kit and get everything out, we need to make sure we've got a nice flat area that we can work with, and we need to clean it. We need to get some detergent, some spray, some wipes, whatever you use, and give that area a quick clean, just to stop any contamination, because contamination can affect our results, so you need to make sure this area is nice and clean. Okay, so moving on to step number 2, the next thing you do is you need to wash your hands. Wash your hands with some soap and water, so again, they're nice and clean and it's not going to contaminate anything. Okay, so moving on to step number 3, I've changed the angle slightly so you can see the desk a little better. You're going to lay out everything that you need for this test. So we've got our disposable swab, we've got our extraction solution, our extraction tube that we spoke about earlier, and how they differ slightly between different kits. You already know about that. You're also going to get a cup. Remember, if you don't have an extraction tube holder, you're going to need a cup just to place this in once you put your solution in there. We're going to go through this bit a bit later, but it's just good to have it ready there. You're going to get your test cartridge and leave it there as well. Also, I like to have some tissues available if I need it. I'm going to put that there as well, so it's nice and ready. Please do remember though, when you open this test cartridge, there's a reason it's sealed, because as soon as you open it, it only really lasts half an hour, so it gives you half an hour for you to put your solution on there, okay? So if you're going to be a while, don't open this until you actually need it, otherwise you're going to waste the cartridge. Moving on to step number 4. Now this is the part where things are different between different testing kits. So remember, I'm using the Innova IVD one. You might have a box that looks exactly like this, and if you don't, things might be different in terms of what you do, so please always read that information leaflet to see exactly what you need to do. So with the IVD one, we need to prepare our extraction solution. We need to put in our extraction tube. Remember, like I said earlier, some of them already come pre-filled, some of them come with a sachet with the correct amount. The IVD one doesn't. It gives you a bulk amount of solution like so, and you put 6 drops within here. So make sure not to touch the sides, and 1, 2, 3, 4, 5, 6, like so. Don't put more than 6 drops in, 6 is plenty enough. And remember, there's only a limited amount of solution in here, so you don't want to waste it. So once you've done your 6, pop it back in your little cup thing to hold it upright so it doesn't spill out, and close your lid of your extraction solution. Easy as that. But remember, like I said, the testing kits do differ, so please read up that information leaflet. Moving on to step number 5. The next thing you want to do is blow your nose, which is why you need to have that tissue paper ready. Give your nose a quick blow just to get rid of any mucus in the nose, because the next thing we're going to do is we're going to be using the swab soon, and the last thing we want is for any blockage in there that's going to stop us from using it properly. So give it a quick blow and then throw it in the bin, the tissue, and then go and wash your hands and come back to your workstation. Okay, so now that your hands are nice and clean, we can move on to step number 6. Now we're going to prepare our disposable sampling swab. Please notice how it says open on this end of the sampling swab. The reason for that is that this end is where the handle is, okay, the plastic handle. This end is where the fabric side is that we're going to stick in our nose or in our throat, and we're going to go through that in a second, okay? If it doesn't say open, just open it on the side that the handle is, okay? So give that a quick open, if I can open it, that is. So just open that up so it's ready. I never open it fully, I only open it about that much, just so it doesn't get dirty and contaminated. I'm just going to place it here for now, just so it's ready. So moving on to step number 7, this is where it starts to become a little tricky, because different testing kits have different instructions. So the IVD Innova one, which I'm going to show you again, the box that I've got, the information leaflet states that you only need to do the nasal swab, so you need to swab in both nostrils, okay? But other testing kits require you to do a throat swab and a nasal swab. So please, please, please read that information leaflet so you know that you're doing the right thing for your testing kit, so that you're getting the correct results. Now, if you are someone who just needs to do a nasal swab, like the IVD one, then just move to step number 9. Miss step number 8 that I'm going to go on to next, because this is all about the throat test and the nasal test, okay? Let's keep on going. Moving on to step number 8. Now we're going to look at the throat swab. So if the instructions state on your test kit that you need to do a throat swab, this is exactly what you need to do. So ideally do this 30 minutes after eating food, because if you just eat and you're going to have all that food in there and it might contaminate your results. So it's ideal to do it 30 minutes after food. So to do it, you're going to open your mouth nice and wide, you're going to get your swab, and you're going to rub the fabric end 4 times on each side where your tonsils are, okay? I'm going to have a diagram pop up at some point as well which shows you where the tonsils are. I would highly recommend that you use a mirror, okay? It just makes life a lot easier for when you're trying to find where to actually place the fabric end of the swab and for rubbing. Also, please remember that the fabric end shouldn't touch your gums, it shouldn't touch your teeth, it shouldn't touch your tongue, because it can contaminate the result. So if it does do that, you're going to have to throw this away and start a new one. So excuse me for doing this on camera. I'm not sure how much you're going to see, but I will do it on camera for you, and I'll have a diagram pop up. But yeah, just excuse me for doing this on camera. So I've got this, and I've got the fabric end right here. I'm holding it from the plastic end. Open your mouth, and then just rub it 4 times on each side. So that's the first side done. So that's done. I didn't contaminate it. I went straight to the position it's used to be. You do get used to it. I have done this a lot of times, so I've got very good at it, but I'd highly recommend that you do use the mirror. So that was step number 8. So moving on to step number 9, as you can see, I've still got the swab, the same swab that I've used on my throat in my hand, ready to go. So again, this bit differs depending on your testing kit. If your testing kit tells you to do a throat swab, which we just did, followed by a nasal swab, you only usually need to do one nostril. However, please read the information leaflet because it might tell you to do 2. So I'm not too sure what your testing kit will tell you to do, but usually it's only one nostril if you've done a throat swab. If your kit is like my kit, like the IBD one, which I showed you earlier, it only requires you to do a nostril swab. So it doesn't require the throat swab, and you do 2 nostril swabs. Now the way you do it is the same for depending on whichever kit you've got. It's the exact same thing that you're going to do. So you're going to get your disposable swab, you're going to hold it upright, you've got your fabric end there. And again, I've got my mirror here ready because I always find the mirror helps a lot. And you're going to push it upwards gently into the nose and rotate it 10 times. Now please remember, I find this one more difficult than the other one. Some people find the other one more difficult. It always makes me sneeze. It sometimes makes my eyes water as well. But you need to be very gentle with it. You push it in about 2.5 centimeters. You don't need to go in super deep or anything like that. Just gently push it upwards until you feel some resistance and stop. You don't need to keep going high up. But the aim of the game is to get as much of that mucus and all your liquids on here so that we can then test it. So I'm going to do both now, okay? I'm going to do both nostrils, and when you put it in, you're going to twist it around 10 times. So we'll start with the right. So I'm looking at my mirror, and as you can see, I'm going up just to where I'm comfortable, and I'm going to spin. So you can see, so I'm spinning it there. I might actually sneeze in a second as well. So that's the first one, and now I'm going to do the second one. So as you can see, rotating it, you want to do it 10 times. I don't even know how many times I've just done it now because I was trying not to sneeze for you on camera, but it's as simple as that. That has now got everything that I need on it, and we're going to move on to the testing solution. So I'm going to move this out of the way. Let's move on to the next scene. So moving on to step number 10, all the hard parts are done now. We've got our sample ready, and remember, we've got our buffer solution ready in our sample tube like so. You can probably see the liquid there slightly, okay? So what I'm gonna do is I'm gonna try and focus on this actually, see if that's better, I think. Okay, so I'm gonna put this guy into here, and I'm gonna mix it in there for about 10 to 15 seconds. Okay, and keep twisting it. You can squeeze these as well, so I don't know if you can see that. That just helps to get the stuff off it as well, so it all goes in that solution that we put in there earlier. So we're just getting it out there. You can kind of like push it up like so, pull it up like so, just to get everything off of it. So once you've done that, and it's all mixed in there nicely, pull it out, hold the edges so you can kind of scrape any extra solution off it. The more you've got left, the better. Okay, because sometimes you're not left with too much. So that's all done. That's all in there for us now. And with this, I'm just going to throw it away in my bin or in a plastic bag that you've got ready. So now that we've got this ready, we can move on to step number 11. As you can see with this one that I've got, it's got a little pipette thing on the top. So you're going to close that like so. Now that's ready to be used as a dropper, okay? Next thing you're going to do is you're going to get your cartridge. I should have really opened this earlier, but it's fine. So you're going to get your cartridge. We've seen this earlier, we've seen how it works. I'm going to try and focus on it again for you so you can see it a bit better. So your sample goes in that little well there. That's where it shows you results, okay? So now hopefully you can focus on me again. Now we're gonna put, depending on your kit again, with the IBD one, it only requires 2 drops to go into that sample well. However, other testing kits require 3 drops, they require more. So you need to look at that information leaflet again. You need to make sure that they're good sort of drops so they're not too airy either. So I'm gonna do this on a flat surface. Unfortunately, I can't do it in front of the camera for you, but it's just gonna be 2 drops like so. So 1, 2, and that's it, okay? So we're gonna leave that now for 30 minutes. Again, this kit only requires 30 minutes. I'm gonna put my timer on my phone, which is here. I'm gonna time it for 30 minutes, and then I'm gonna see what the result states. Again, you need to read your information leaflet that comes with the kit, because different kits require different time for this to be left, okay? But the most important thing is, whack on that phone timer so that you know exactly when 30 minutes is done. You can have a look at it and see what the result indicates. Okay, so I hope you're finding this information useful so far. We've gone through the step-by-step instructions. Now let's look at results, okay? So it's been half an hour now, my phone timer has gone off, so now these results are ready to look at. Please remember, any result before half an hour is not accurate, so you need to do it for half an hour and then look at the results. If you leave it for an hour as well, it might no longer be accurate as well, so you need to put that timer on, and at half an hour once it's gone, or whatever time it is for your testing kit, please remember that, because your testing kit might not be half an hour, put that timer on and look at it exactly at that time, and that is your result. So for this kit, which is the IBD Innova one, don't know if it's not focusing, I think that is. I hope you can see that. So the C line, there's one line on the C which indicates that this was a negative COVID result, okay? So thankfully, I don't have COVID, so I'm negative. I have been vaccinated as well, so it's quite unlikely. But, so the C, one line for the Innova testing kit means that it's negative. If you have two lines, so the C and the T have a line, then that is a COVID positive test. Now, another thing to mention, which is really important, is when your test is void. So please read the information leaflet for your testing kit to know what indicates a void test. So if your test is void, you're gonna have to redo it all again. So for the IBD Innova one, it's pretty simple. So if we look at this again, I'll focus on it again. So if you didn't have any sort of lines on it, so it was clear, I think you can see that there. If it was clear with no lines on it, then it's void. Also, if it has nothing on the C and it's just a line on the T, for example, that also indicates a void result on the IBD Innova one. Please, let's focus again, but please remember, read that information leaflet for clarification. So with your results, what do you need to do with it? Well, that's the important part as well, because this is good data to have. So obviously, put it wherever you've been instructed. Usually you will have instructions with these sort of things wherever you are in the world to put that data wherever you've been instructed, whether it's a website, whether it's a phone in, wherever. But also it's super important that if you're here in the UK, that you put it on the Gov website as well. This is the NHS Gov website for these testing kits. Not only if you've got a positive result, but if you've got a negative one as well. So they've usually got a code here as well that it will ask you for, and you pop that on there and you put your results on. It literally takes a few seconds to do, but it's really, really useful to have that information. If you don't have online access, you can also phone this in, and I will leave all of these details in the description below for you. So the next question is, well, what do we do with these results? Well, if you've got a positive COVID-19 test result, and it means that you've got COVID-19, and you're not showing any symptoms, you need to self-isolate still, because you've done the test, and it's indicated that you are positive for COVID-19. You need to self-isolate immediately, and anyone who lives with you needs to self-isolate as well, and you need to book in for a PCR test as well. I am going to leave more information about this in the description below, so if you want more information on it, please feel free to give it a read. And please remember that if your test does come back negative, then it's unlikely that you have COVID-19, but you still need to follow all the social distancing rules that we have in place at the moment. So you need to wear your mask, you need to wash your hands regularly, you need to leave at least 2 meters between people, okay? So all of that stuff still applies. It doesn't mean that, oh, I'm negative and I can go and do everything like how it was before. At the moment, we're in a pandemic, and these things are in place to save lives and to help reduce the spread, okay? So just because it's negative, it means that it's unlikely that you've got COVID-19. It's not 100% rule out either. So please do remember that. Also, if you've got a void test, like I said earlier, you need to redo the test, because that's a void test. It basically means that it was a waste. It doesn't mean anything. The result means nothing and it indicates nothing, so you need to redo the test. Also, I thought I'd quickly mention, when I say redo the test after a void test, it means you need to do a brand new test. You can't reuse this test strip that you've already used. You need to get everything out new from your testing kit like we did earlier and redo it all again. So a brand new swab, brand new extraction liquid, brand new testing strip, everything needs to be brand new, re-clean your area and start again fresh. So now let's move on to some frequently asked questions that I'm getting on my Instagram and also on YouTube. So the first question is, if I've had a nosebleed, how long do I need to wait to do a test? Well, if you've had a nosebleed and it's in one nostril, then you can use your other nostril to do the test. However, if it's in both, you have to leave at least 24 hours before you redo the test. Moving on to the next question, do I have to report my results result, even if it's negative or void? The simple answer is yes. Okay, you've got to tell the NHS via the Gov website. This way they can keep better data on how it's spreading and how well the tests are doing as well. So even if it's negative, even if it's void, you still need to report it on the Gov website, which I've linked in the description below. The next question is, can I use the nasal swab if I have nose piercings? The simple answer is yes. However, if you're only using one nostril, for example, let's say your piercing is in your right nostril, then you can just use it in your left nostril, okay? But if you need to use both nostrils, then you just need to take your piercing out and do the swab in both nostrils. And the last question is as follows. If I tested negative, does this mean that I am immune to coronavirus? The simple answer is no. This test, as I explained earlier, it's an antigen test. It's just checking for proteins that are specific to COVID-19. If it's positive, it just indicates COVID-19. It doesn't mean that you're immune to COVID-19. It doesn't mean that you've previously had it and you've got antigens or anything like that. It's just indicating a positive COVID-19 test. So that's the end of this week's video. You are now a COVID-19 lateral flow test pro. You now know all about how it works, you now know all about how to use it, you now know what to do with the results, you know everything there is to know about the COVID-19 lateral flow test. I really hope you found this information helpful. You're a pro now, so tell your friends, tell your family, tell your loved ones, tell anyone, whoever you're watching is doing it, give them tips because you now know everything there is to know. As always, I will see you next week, Monday 4 p.m, and as always, sending you all awesome vibes. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.